Well, guys, I'm really privileged to be able to share this message with you today. It's one reason why it's on our hearts always to reach out to community and speak with people, because there's a lot of things that people don't realize and know, particularly with their health, with the way things are. And I always ask this question before I share this information, and that question is, does anybody here believe that we were created to live a life of sickness, disease, and an ill state of health until we slowly crawl into our grave and die?
I do.
Yeah. and you know what's funny? No one really actually says they believe that, but
except for
except for him. You're the first. But you know, we kind of act like we believe that. If you look around today, you can see that families are spending on average $300 a month on prescription medication, and that every 30 seconds there's an American that drops dead from a heart attack, or 1 in 88 boys actually is diagnosed with autism. Or even further right now, if you look at the way we're spending as far as money on healthcare, we're spending more than any other nation in the world. In fact, we're taking more prescription medications than any other nation in the world, right? Yeah, and that's why it's our mission in our office to raise the health and transform the health of our community, to let them know that you weren't created to live a life of sickness and disease, that you're created to live a life of health and vitality. And one of the amazing things about our office is that we work with the body to get you to obtain that health. We work with kids, infants, all the way up to grandparents. And I'm going to show you a little bit about how we do that. And we do that through the most important thing in your body, the nervous system. Everybody, if you look at Gray's Anatomy, which is the standard text for understanding the body, it says in the first chapter that the nervous system controls every single function in the body. So if we look at our structure of the spine, our brain that sits up here has to send messages down our spine, from inside our spine out through these nerves, to every cell, tissue, muscle, and organ. And it's so important for our brain to have that ability to communicate, because that's what runs our entire body. Make sense so far? Now, where I come in is we look at the spine. We want to always have good structure, because our good structure is going to help our nervous system function the best. And what exactly do I mean by that? You notice that our spine is made up of many, many bones. Now these bones are going to help us move back and forth, side to side, and what will happen is we'll find that these bones misalign and become stuck. Okay? Now when this bone misaligns and becomes stuck, can you see what's happening in this nerve here? Pinch, right. The nerve is becoming strangled. So I said those messages are supposed to flow from the brain through the spine or body. We think are having the messages now.
Not so good.
Not so good, not getting through. So whatever the nerve's trying to send messages through will not get that message. It poses a little bit of a problem, right? Especially since nerves go to everything in our body. So what our office specializes in is locating these misalignments, putting the bone back into alignment, and restoring the proper structure, taking the pressure off the nerve, restoring the brain's ability to communicate through that nerve. Okay? Now, when this happens, there's a name for it, and it's called a vertebral subluxation complex. A really long name.
That was on Jeopardy yesterday, I think.
Really?
And you got it right.
Good job. You know, some people always ask me, they're like, okay, doc, you said I had a submarine in my spine. Like, but no, basically the word is referring to that nerve interference that's occurring from that misalignment in the bone. Now, we have practice members that come in our office and they have these vertebral subluxation complexes throughout their entire spine. We see these subluxations in the upper part of the neck, so seeing things like migraines, double vision, sinusitis, ear infections. In fact, actually, those are two common reasons we see kids in our office for sinuses and ear infections. Obviously, a misalignment will occur in the middle part of the neck. Well, those nerves go to the thyroid, so hyper and hyperthyroidism. The upper part of the back, well, those nerves go to the heart and lungs, so heart arrhythmias like tachycardia, high blood pressure issues. Also, with the lungs, asthma, chronic bronchial infections. We'll see some of that. Also, misalignments of subluxations in the middle part of the back. Well, those nerves go to the stomach, so stomach ulcers, indigestion, acid reflux. We've seen a ton of cases with acid reflux. In the lower part of the back, well, those nerves go to different parts of the gut. Anyone heard of irritable bowel syndrome, diverticulitis, Crohn's disease? Yeah. So if those nerves going into the gut aren't working properly, your gut's not doing the correct things to try and digest the food and properly process that. Of course, these subluxations can occur in the lower part of the spine. Those nerves go to the kidney stones, bladder, UTIs, also reproductive organs. Now, remember the testimony I mentioned earlier, the girl who had a lot of issues with her ovaries and her uterus. Well, we've seen a lot of women with irregular cycles, gentlemen with ED, and both genders with infertility issues. We've actually seen families become pregnant because of removing these subluxations. So, pretty amazing story. Now, of course, I said these are the organs that these nerves go to. These obviously go to our joints, they go to our muscles, and that's what causes numbness and tingling, and also a lot of the aches and pains that we most commonly see in the office as well. Okay, and it's so important to get checked so we can restore that proper structure to get that proper function. And it's so vital. Now, what our office specializes in is we want to find these, and we find this in multiple ways, and we do this through the technology that we use. Okay. We always want to see how our nervous system's functioning because we're a neurologically based chiropractic office, okay? We don't want to just approach the bones and muscles because then we completely disregard the most important structure, okay? There's two types of technology that we use. We have technology that actually detect nerve function through a daily nerve analysis, which sees how your nervous system's functioning on that day, and then also through a neurological diagnostic test, which is an overall view to let us know how it's balanced, and we use it for our reassessments to see how you're progressing through care. Okay? But the most unique thing to our office is due to our motion x-ray. Traditional chiropractic, we always would take a picture of the spine to see those misalignments. Now, if you remember earlier when I said we get these misalignments occur, but they get stuck. See, that's the other part of the problem is you can have bones misaligned and still move. But if it's stuck, that's where the true interference is coming from. And that's where motion x-ray comes into play. Now, it's giving us insight into the spine that hasn't been seen before. And this is a video right now of the motion x-ray that we're using. And if we can assess the motion in between those bones, it'll tell us what's truly stuck and misaligned so we can approach the spine the way it needs to be. Especially with surgical cases. I've had people come to my office and say, Doc, it's already too late for me. I've had surgery, it's not working, and you can't really mess with my spine. It's too dangerous now. This technology is allow us to determine how your spine's adjusted to that surgery and how we can still approach it to get you the correction that you need. And, amazing thing is, it's never too late in our office. We've seen some pretty far gone cases, and with this x-ray, it's allowed us to take care of those. Also, the more sensitive neurological cases. Several of you are very familiar. I mentioned ADHD and autism. So vital in making sure that we're as specific as we possibly can be when approaching the spine so we can get them that health that they're looking for. Okay? And every time I speak, there may be someone you're thinking of right now that I've mentioned something that we've seen before in our office, maybe a loved one you care about. And it's on our heart to serve the health needs of this community because right now, as I told you, we are in a healthcare crisis situation. There's no question about it. And there are a lot of people out there right now that are on their knees praying for an answer because they've tried everything and done everything. And that's why our office is here in this community because there is a dire need for specific and scientifically based chiropractic care to get these individuals victory over their health concerns. So thank you guys so much.